Hey there, welcome to GrowMed. If you are new to GrowMed, subscribe to GrowMed and tap the bell icon so that you do not miss any study session. In this video, we will be discussing a very important topic for the FMGE, that is the meningitis. It is a previous year topic and a repeat topic. Frequently questions are asked on this meningitis. So either the clinical case or questions asked on its causative organism or the CSF findings and on the treatment. So you need to look at all those points. So let's start the video. Meningitis, the definition is inflammation of the meninges. So the meninges, which are covering of the brain and the spinal cord, these are the pia matter, then the arachnoid matter, dura matter. So whenever there's inflammation of these meninges, it presents with meningitis. Okay, and the clinical features are fever, headache, nuchal rigidity, and lethargy. Along with this, there can be other findings also seen, like in severe cases the patient can present with seizures, nausea and vomit, then neck stiffness. So there are two important signs seen in the meningitis, that is the Kerning sign and the Rudinsky sign. This Kerning sign, you can see it when, so it states that whenever you flex the hip at 90 degrees, there will be pain, and due to the pain you cannot extend the knee. Okay, so this sign is called as the Kerning sign, and likewise the Rudinsky sign. It is said positive when you bend the neck is bent, then knee and hip flex. So when you see this, then you will be calling it as the Brudinsky sign positive. Then moving on, based on the causative organism, it is classified into various categories like bacterial, viral, fungal, and the TB. And also the CSF finding is different for the different type. So you need to by heart this whole table of the CSF finding, because questions are asked in a clinical case giving that patient with these symptoms like fever, headache, nuchal rigidity, and when you have done the CSF examination, you find the neutrophils, then glucose is less and protein is increased. So which of the following is the diagnosis? So it will be bacterial meningitis, or they can give the same thing and they can ask that causative organism. So let's discuss the CSF findings in the each of the type. So bacterial, the causative organism is the Streptococcus, Pneumococcus, and the Neisseria. This is also different for different age groups. Like in neonates, the most common is the group B Streptococcus in India, and in children it is the Pneumococcus, whereas in adults also it is the Pneumococcus, and second most common is the Neisseria. So one line can be asked that most common cause of bacterial meningitis in neonates, it is the group B Streptococcus, then children Pneumococcus, okay, like that. Then the CSF findings, the cells which are predominant are the neutrophils, then the glucose is reduced and there is increased protein seen, and treatment is the antibiotics. Then the viral, the most common cause is the enterovirus, and second is the HSV2. So the findings, CSF findings seen in this viral are the cells which are predominant are the lymphocytes, WBC, then blood glucose is normal and the protein is elevated, and the treatment is acyclovir. Then fungal, the causative organism is the cryptococcus. So most common is the cryptococcus, and repeatedly questions are asked on this cryptococcal meningitis. Okay, then other are the aspergillus. So the cells which are predominant are the WBCs, then blood glucose is reduced and the proteins are elevated. And for the treatment, most commonly amphotericin B is used. Then TB, so causative organism tuberculosis. Then cells predominantly elevated are the monocytes. The blood glucose is reduced and the proteins are elevated. And the treatment is by the anti-tubercular drugs. So in the TB, you can see a very important finding, that is the formation of cobweb coagulum, as you can see here in the image also. The cobweb coagulation formation. So image based question can be asked, and also in TB the CSF color will be straw color. So if at all the examiner is asking about the TB meningitis, then these buzzwords can be given in the question, like the cobweb coagulum, then the straw color, then this monocyte. Okay, so now let's discuss about the cryptococcal meningitis, which is a very important topic and a previous year question, so it is a repeat topic. So this is most commonly seen in immunocompromised patients and also AIDS positive and truck driver. So if these things are given in the question, that a patient presents to your emergency with fever, then headache, then this nausea, vomiting, lethargy, okay, and then he is a truck driver and his CSF analysis shows these things. So what is the patient suffering from? So it will be the cryptococcal meningitis. Also image based questions are asked on the cryptococcal meningitis. This investigation of choice for the cryptococcus is the CSF ELISA, and on MRI it gives soap bubble appearance, as you can see here. So this soap bubble appearance is seen with the cryptococcus. And another investigation which will help us to identify it as cryptococcus is India ink positive, this one image. So question was asked that which of the following will help us to make the rapid diagnosis of the cryptococcal meningitis, and it was the India ink positive. So this one image, you can see here that the background is black color and this cryptococcus, they are white color. So this image can be asked in relation with the micro, that the image will be given. You need to first identify the organism that it is the cryptococcus, and then it causes the meningitis. So this was a quick video. So the other questions asked from this meningitis is that the Neisseria, it occurs due to the deficiency, complement deficiency of the C5 C9. And then questioner also asked on the treatment. So for prophylaxis in surgery, you will be using ceftriaxone. So this is also a PYQ. So this was a short quick review of the meningitis, and you need to remember all these points from the meningitis. Thank you so much for watching this video. Hope this will be useful to you all. Like the video, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed. All the best for the FMGE exam. Thank you so much. Bye bye.